All right, we're going to be palpating the frontal bone. So that's the front part of the skull right in here. And I'm going to be outlining all of its edges, plus labeling a majority of its bony landmarks. So I'm going to be starting just between the eyebrows. So these two bones right in here are known as your nasal bones, and where they come up, they meet with the frontal bone. This is a location called nasion. And then from there, I'm just going to move slightly lateral, and I'm going to find the upper part of the orbit. So the frontal bone makes up this superior orbital margin right in here. So this is the outline of the bony edge, and you can kind of feel a sharper border as you run your finger all the way along, and then it meets the zygomatic bone on this side. So you have a frontal process of the zygomatic bone kind of meeting the frontal bone here. So this is the superior orbital margin. I'm going to go towards the medial aspect of it, and I'm going to feel gently back and forth, and I'm looking for a little pit or a divot. So this is known as the supraorbital notch or foramen. So I'm feeling that currently right here. A way to confirm that I'm on this location is to feel for a gentle pulse, which I can feel. Please do take caution not to push really hard, since there is a superficial nerve there as well. And you can have either the notch or the foramen. You could have two notches or two foramens. So again, you can try to feel left versus right and see if you can feel the difference between the two of them. Above that, as you take the flat of your finger and go kind of in a superior-inferior direction, you should feel a raised part of bone sticking up. So the hair above the eye is known as ciliary, and this is supraciliary ridge. So sometimes known as a supraciliary arch, but you can easily feel this bony area as it goes back and forth. So we're going to be palpating that. Centrally, right in the center of the forehead, is just a landmark called glabella, often not necessarily associated with any muscle attachments, but it's just a location on the bone. So again, the glabella is right dead center. If, and depending on the person that you're palpating, just in kind of the forehead location here, it can sometimes be raised. So this can be known as the frontal eminence or the frontal tubercle. So if you palpate back and forth and it feels like it's quite raised, sometimes people that have a widow's peak have a little bit more pronounced bony structure in this location. And I'm just going to be turning my model's head to the side here. So as I follow that super kind of orbit towards that zygomatic bone, if I roll off the back side of it, I will start to feel a bony edge. And this is the beginning of our temporal fossa. So there's something known as the superior and inferior temporal lines, and this is the outer edge of that temporal fossa. So right in this location, I'm going to actually ask you to clench your teeth together, and I'm activating the muscle known as temporalis. So temporalis is activating, and I can feel the frontal bones portion of those temporal lines as they start to go superior and then back along the parietal bone. We're going to bring you back towards center. I'm going to be a little bit harder to see, but what I'm going to do is palpate on the top of her head a little bit. And if you go dead center right in the middle and feel back and forth, there is going to be a split between the two parietal bones. I'm just going to have you tuck your head down for us. Good, like so. So this is known as our sagittal suture. So this is the separation between the left and the right parietal bones. And I want to follow that sagittal suture forward until I feel the frontal bone's meeting point. So now I can feel the suture from running this way, known as your coronal suture. So this is where the frontal bone meets the parietal bone. So you have a coronal suture running this way, as well as a sagittal suture running this way. And this location where they meet is known as bregma. You can bring your head back up to a neutral position. So we've outlined that the frontal bone makes contact here with the nasal bone, a little bit with the maxilla, on the sides with the zygomatic bone, and then posteriorly with the left and right parietal bones. That is going to be all the landmarks we're going to discuss for the frontal bone. We're palpating the parietal bone next. I'm just going to turn our model's head to the side here. So we're going to be outlining again its bony landmarks. There's not too many different landmarks that we're going to discuss, but we'll talk about where it's meeting some of the other bony edges. So I'm just going to go on the top of the head, and I'm locating where the frontal bone meets the parietal bones. And now I'm going down along the coronal suture right here. So the front part of the parietal bone is in this area here. I'm just going to turn her head and face it downward. And it runs together, left and right, parietal bones until they meet the occipital bone in the back. So we have a landmark that kind of helps us identify where bregma is in the front and lambda is in the back. And then I'm going to have this lambdoidal suture that kind of runs down, so separating the occipital bone from the parietal bone in this location here. So the parietal bone, I'll bring your head back to the side here, runs down the majority of the way, but then it's going to be meeting up with the temporal bone, which is going to be just above the ear in this area. However, the suture will not be palpable since it is underneath the temporalis muscle. So really the only bony landmark that we're going to discuss for the parietal bone itself is the outline of the temporal fossa and the temporal lines, both superior and inferior. You're not going to be able to separate the temporal lines. So if you've already watched the frontal bone palpation, what I'm looking for is where the frontal bone comes down to the zygomatic bone right here. There's our little suture. And this is the beginning of those temporal lines. So this is frontal bone, and then it's going to round the corner and start to work its way back onto the parietal. So I'm going to have my body continue clenching and releasing her jaw as I'm following these temporal lines. So the temporal lines will not be able to be separated. One is more the actual muscular fossa, but there's also some fascial connection over top of this muscle. So part of it is muscular attachment and the other part is going to be more a fascial attachment. So parietal portion of it, and then this temporal line is going to drop down towards the ear. However, this part is going to be the temporal bone. So a big chunk of this muscle known as temporalis is covering the parietal bone as well as the frontal bone, and then when we get to it, we'll talk more about the temporal bone. So that really is everything that we need to discuss to do with the parietal bone. We are going to be palpating the occipital bone, and so we have our person facing in the opposite direction this time, because the occipital bone is the back of the skull here. So we're going to be outlining which bones are kind of articulating it and creating some sutures, plus pointing out some of the major landmarks. And we have a lot of posterior neck musculature that's going up and attaching to the occipital bone. So we've just gone through in previous videos that where the parietal bone meets this occipital, but again, I'll just quickly, we're going to roll her head back this direction here. So I'm going to be finding the sagittal suture. I'm going to be walking back, feeling for that suture line to where it meets the occipital bone, which is going to be around this location here. So this would be the lambda location. And then this lambdoid suture is going to be separating where the parietal and the occipital bone meets. So that occipital bone really is this posterior kind of cap aspect here. Okay, so one of the most common landmarks that you will discuss and talk about, which really shows up as a central landmark which helps you identify a lot of C-spine, is going to be what is known as the external occipital protuberance. A lot of people shorten that to EOP. If you're palpating on the back of your head, it's quite a noticeable, obvious bump that's sticking out, and that's kind of an anchoring point for something called the nuchal ligament going down the back of your head. So even from a young age, as you're an infant and you're starting to hold your head up, we're going to have a lot of pressure and pull going onto the back of the occiput, and some of these muscles and other structures start to develop. So this should be a pretty easy to find bony landmark. So we need to locate that to be able to identify other structures. So that's why I'm starting here. One of those muscles known as trapezius, that's going to be again one of its common attachments. Now what I'm going to do is I'm going to slacken her head a little bit by rolling it back. And then I'm going to sink in below that EOP, external occipital protuberance, and walk down the skull. And it's going to be hard to determine, but this is a bony landmark known as the external occipital crest. So this is again for your ligamentum nuchae or nuchal ligament. And if you wanted to try and feel that, you would tip the head into capital flexion, so kind of like a chin tuck, but don't move the neck forward into flexion. So you're trying to bring that EOP and your cervical 7 apart from each other, and you actually create tension straight down the center of this ligament. So that'll pop up, and that's kind of helping you confirm you're in the right location. The next bony landmark that's really common and a multiple muscle attachment is known as the superior nuchal line. So if I find my EOP, I'm going to go off lateral. And if you can kind of envision a large M shape, this bony landmark goes slightly superior, very lateral, and then it's going to head inferior lateral towards your mastoid process. So right in here, mastoid process right behind the ear. So the superior nuchal line. This should be raised. You should be able to kind of strum your finger back and forth across this bony landmark. Centrally, we have more of a trapezius attachment, so upper traps, but laterally towards that mastoid process, we have muscles like splenius capitis, as well as sternocleidomastoid. So if you wanted, you can have the person try to rotate to look over their shoulder on that same side. Good. And I'm starting to feel, in this case, splenius capitis attaching to that more lateral part of that superior nuchal line. Now, as soon as there's something called a superior nuchal line, you probably can guess there's going to be additional lines. So the next one that we're going to look for is, once you've identified this superior nuchal line, I'm actually going to drop below it. And again, I need to relax the head back so I can sink in a little bit. Now, this is not going to be an easy palpation, but if you've located the superior nuchal line, right below it is a very thick muscle insertion known as semispinalis capitis, and then deep to semispinalis capitis is going to be your inferior nuchal line, which has a similar pathway going from the occipital bone over towards the mastoid. This is the insertion of 3 of your suboccipital muscles. However, because of how deep it is, it's not going to be an easy palpate like the superior. The third and final line, again, not always referenced in every book, but if I find the superior nuchal line, I'm actually going to go above it for something called supreme or highest nuchal line. So on our model right here, I can actually quite easily feel that, but there's a slightly raised area. It is behind where that lambdoid suture would be, so make sure you're not in the exact same location. And this is going to be an attachment for a muscle in the scalp known as occipitalis. So you might see this as occipitofrontalis. However, this musculature is controlling some of the scalp's movement. So you can, on some individuals, see if they can raise their eyebrows and the scalp would move posteriorly if they're able to contract this occipitalis muscle. Okay, so we have the external occipital protuberance and 3 nuchal lines for this occipital bone. And there are a few other small bony landmarks, but a lot of them are actually internal. So for the most part, we're going to leave it at that for the occipital bone landmarks. We're going to be palpating the temporal bone next. So temporal bone, as a general, is right in this area here. Has quite a few other connections to bones that we're going to be discussing, kind of what bones are around it. We won't go in depth on too many kind of the sutures in this one because most of them are not palpable, but we are definitely going to be pointing out a lot of bony landmarks as we go through the temporal bone here. I'm going to start a little bit more towards the back and try to find, again, a landmark that if you've watched previous videos on the skull, the temporal fossa. So this is the temporal bone and the temporal fossa. So a very quick recap, I won't go through everything in detail. We have a frontal bone here, we have parietal bone here, and then it starts to drop down onto the temporal bone. I'd like to point out that the temporal fossa goes behind the ear and it actually goes underneath the ear. So if you're palpating superior and posterior to the ear and you ask your body to clench their teeth a few times, you will quite easily feel temporalis moving in the temporal fossa through this location. So temporal fossa technically is made up of 4 bones. That was 1, 2, 3, and then the 4th one is going to be the sphenoid bone, a little bit more anterior. But this is often the temporal fossa gets its name for temporalis, and again that muscle. So that's going to be above the ear here. I'm going to turn the head slightly, kind of show you behind the ear. So as we pull the ear forward, this landmark right in here is known as the mastoid process. So it's quite easy for you to grab. And a muscle that I'm kind of outlining right now is sternocleidomastoid. So that's going right up and inserting into this mastoid process. You also have two other muscles utilizing it as an attachment too. So this is something you should definitely get to know. As I go kind of posterior to it, I'm going to point this out on the ear by pulling on her ear. So this is going to get a little bit tricky. And let's see, waiting for the camera to zoom in a little bit. But as I pull in, we're actually seeing a little bit of this fiber coming off the back of the ear. I'll stress it a little bit. So this is known as your auricularis posterior. It's a muscle that kind of pulls the ear back. And it is originating, depending on your source, on something called the mastoid area or part. So I'm just pointing that out, that this is the process, and a little bit more superior towards the occipital bone in here is the mastoid area or part. So that's kind of directly in line, this posterior auricularis muscle. So sometimes that needs to be mentioned in reference. Okay, I'm just going to lift up her ear a little bit. If I go in front of this mastoid process directly below the ear, I'm going to take some time. I'm not going to push too hard, but underneath and in this location is known as your styloid process. So you have this small bony projection that's sticking down. This is for your stylohyoid muscle. So if you're wanting to confirm this one, you could ask your person to swallow, which is one of the main functions of the hyoids as a group, is they help maneuver the hyoid bone during swallowing. So the styloid process tucked up underneath here. We're going to bring the head back to neutral. Now we're not sticking our fingers inside people's ears as much as you might like to, but instead what we're going to do is we're going to find this little flap of skin. Some people will call this the tragus. So you might hear of a tragus piercing. And I'm going to take that skin and I'm going to cover over top of her ear hole. So the tragus, and we cover it, and the outer ear hole has two names known as the external acoustic meatus, or meatus, or the external auditory, auditory meatus. So again, instead of sticking your finger inside and plugging it, we're just taking this flap of skin and covering over top of it. So that's going to be, again, obviously closing the ear hole. For me, that's an easy way to confirm it instead of sticking an object inside. Just anterior to this tragus and the skin is going to be the beginning of this zygomatic arch, and then there's a few more bony landmarks around this. So again, we'll come back and explain them kind of one by one, but I'm going to start with the arch. So the zygomatic bone, which is the cheekbone here, is going to be projecting posteriorly towards the temporal, and then the temporal is going to be kind of pushing forward, and they kind of meet somewhat in the middle, right around this location at their own suture point. But this whole area is called the zygomatic arch. So the temporal bone has what's known as a zygomatic portion going forward, and then the zygomatic bone has a branch going back towards the temporal. So you might see and hear those two, or you might just call the whole thing zygomatic arch, but please know the posterior part is mainly made up of the temporal. Just below that, I'm starting to feel kind of a round ball-like structure. And this is actually the head of the mandible. It has a couple other names as well. So you might hear this as the condyle or condylar process versus in front of it, this is the coronoid process. So to confirm that I am on the head of this mandible, I'm actually going to get her to open her mouth. So as she opens her mouth, I can easily feel that bone move. And as you close, it goes back up in place. Let's do that nice and slow again. You'll feel it go right past my fingers. It's wiggling a little bit. And then again, close as it goes past. So that is the head going back up into the fossa of this. So this is the mandibular fossa of the temporal bone. As this mandible, the head of it is going back inside. So you can't really feel the mandibular fossa of the temporal bone because it has the condyle inside of it. But that would be deep to this location. Next, along this arch, there's going to be something called the articular tubercle. So I need to find that condyle of the head, and I'm going to drop to the inferior surface of the zygomatic arch just in front of it. And there's going to be just basically a bump on the bone that's sticking inferior, a tubercle. As a person opens their mouth, the head is going to drop inferior and translate forward as it goes past this articular tubercle. As they close their mouth, it goes past and then goes back up and in. If you've looked in-depthly at the joint structure of the TMJ, temporomandibular joint, you will know there's a disc in there as well, an articular disc, and this is what's helping move the head and that disc back and forth as you open and close. So that might be something you want to further look into, but for now, this is the articular tubercle just in front of that mandibular fossa. Working our way again along this zygomatic arch. Now the arch itself is kind of hard for you to see just to feel it this way, but what you're not seeing is if my finger was the arch, then the temporalis muscle is actually going underneath it. So the arch is more visually seen from looking up and down on it as the temporalis goes underneath this arch. So again, that's going to be part of the temporal bone. So quite a bit going on with the temporal bone. Make sure you go through this once or twice and get all of those landmarks down. We're going to be palpating the maxilla. So I'm going to be kind of looking at below the eyes and around the sides of the nose here. So I'm going to start on one side, and I'm actually going to be starting just below the orbit. So the maxilla is going to be meeting up with the zygomatic bone right through this area, zygomatic. And then the maxilla is going to be the infraorbital margin, more on the medial aspect of it. And that's going to round all the way up towards the frontal bone and the nasal bone. So this is technically right where my finger is, right to the inside corner of the eye, the frontal process of the maxilla. I'm feeling along the orbital margin with my finger until I meet that zygomatic bone. Just underneath it, I'm going to sink in. It's a little bit more medial than it is lateral. I'm feeling for another little pocket or a pit. This is a foramen right here, so I've located it. And this is below the eye, so this is the infraorbital foramen. And just like the supraorbital foramen of the frontal bone, if you gently rest your finger, you will feel a light pulse in this area. Again, take caution that you're not going to push too hard because there is a nerve coming out from that same foramen. Palpating all along the outer edge of the nose. I'm going to go through the nose just briefly here, just so you have an understanding that this is cartilage that I'm moving back and forth. So it is dense cartilage. However, it still can be a little bit more mobile. And when you follow that up, you will be able to find where the cartilage meets the nasal bone. So on either side, this is nasal bone versus this is maxilla versus this is kind of the frontal bone, more up in this location here. So down along the outer side of the edge for the maxilla. And as I get in below the nose here, what you want to kind of think about is your four front teeth are known as your incisors. So I'm actually going to go just to the bottom of her nose. I'm going to lift up on it. This is quite sensitive for a lot of people, but if I go left and right, if you go just in the side, this is known as your anterior nasal spine. So that's going to help anchor some of that cartilage. Just be very careful because it is quite sensitive. And below that, and lateral to it, one on either side, here and here, this is known as your incisive fossa. So your four front teeth are known as your incisors, and above the two on the left here, we have an incisive fossa, and obviously the same on the right. As I go lateral from the incisive fossa, I should feel a raised area. And this is for your canine, your third tooth over. So this is known as the canine eminence. So that's right in this location right here. And if I fall off of the canine eminence laterally, I'll end up in another pocket, which is known as the canine fossa. So I'm going to repeat those three one more time. Just above the front two teeth here, we have an incisive fossa on the left side. Then I have the canine eminence over the third tooth. And then I have the canine fossa. Now, if you were to kind of palpate and go back and forth over all the outer edges of the teeth, these are all known as alveolar processes. And basically, you can think of that as a tooth socket. So each one of them has its own alveolar process, but I'm just feeling the external part of it, where you have to go inside the mouth to be able to kind of pinch it to feel the whole structure. So again, incisive fossa, canine eminence, canine fossa, as well as palpation all the way along for alveolar processes. And that's really going to conclude all the major landmarks of the maxilla that we're going to discuss right now. We're going to be palpating the mandible. I'm going to be starting in the anterior kind of front part of it, and then we'll be working our way along the side lateral. So I'm going to be starting kind of in the front. So we have a couple different landmarks right in front of the chin here. Oftentimes, a lot of these things are going to have the term mental or menti associated with them. So I'm going to be starting right dead center. And technically, the mandible was in two pieces at one point in development, and it is kind of fused together. So there's a suture line that kind of runs down the middle, or a symphysis. So you call this a symphysis menti. And kind of a remainder, kind of bony landmark right towards the bottom, right in the middle here. This is known as your mental protuberance. And then on either side of the mental protuberance, you're going to have possibly a mental tubercle. I say possibly because it really does depend on genetics. Some people have a very large mental tubercle on either side. You can definitely tell in jaw and chin structure, versus other people will just have mainly the mental protuberance in the middle, not so much the tubercles on the side. So as you're feeling that, kind of go back and forth from those four front teeth, running down along this protuberance, and then check either to the left or to the right and see how those tubercles kind of feel. If you go above the tubercle, again, the four front teeth on this mandible are known as your incisors. So below that, there's an incisive fossa of the mandible. It's basically in the exact same location of the incisive fossa of the maxilla, right below. And we will discuss a muscle in a different video called mentalis that is originating in this location. So again, one more time, symphysis menti, mental protuberance, mental tubercle, and this incisive fossa. Just like of the maxilla, all of these teeth are in sockets, so you'll have them as alveolar processes, but specifically of the mandible this time, and not of the maxilla, but they'd be palpated very similar. We really are just palpating the outer portion of them, unless you're putting on gloved hands to go internally. I'm going to be turning the head to the side, and we're going to discuss these upper lateral landmarks, and then we will kind of connect these back together. So palpating up near the ear, just in front of it, if you've watched the temporal bone palpation, we've already discussed a little bit of this, but this is known as the head of the mandible, otherwise known as the condyle or condylar process, and this is a part of your temporal mandibular joint, TMJ. So as I'm palpating just below the zygomatic arch, I feel a nice round structure of the head. And again, to confirm that I'm on the head, I'm going to ask my partner here to slowly open her mouth. Good. And close it again. And I can easily feel the head or condyle of the mandible moving and going back up into its fossa. Below that, wherever there's a head, oftentimes there's a neck. We're not really going to be palpating it, but just in case you are looking at a text and following along with that, head and then neck. And there's going to be a secondary projection heading up. However, this is often tucked up underneath the zygomatic arch. The secondary landmark in this location is known as your coronoid process, coronoid. And what you're basically going to do is find the zygomatic bone, drop off below it, and start to hook your finger back onto kind of where this ramus is until you start to feel a little bony resistance. Now, because the very tip of it is up underneath the zygomatic arch, you're going to ask the person to slowly open their mouth. And as they start to open their mouth, your finger's going to get pushed forward. You can see that happening right there. And as she closes, good. And let's do that one more time and open for me. So this is the coronoid process starting to drop out from underneath the zygomatic arch. So I have coronoid process and I have condylar process, and in between them is a notch. So the mandibular notch is basically kind of like, looks like a U shape, or the space of bone in between this coronoid and condylar. I'm going to grab kind of from front to back of this mandible now, and this is known as your ramus. So as we're going down, I'm going to follow this mandible towards what is known as the angle, kind of this location, and that's helps separate our body from the ramus here. So again, this can be finding the front just below where that coronoid process is, and I'm following it down, and you can see quite a bit of musculature in this area. So this is masseter, and that's covering the majority of this ramus in this portion here. So if you were to clench your jaw for me, please. Great. You can feel masseter as it's clenching and help close the mandible or elevate the mandible at the temporal mandibular joint. So the majority of that is going to be covered by muscle tissue. Again, the angle, quite easy to see, as it's a change in direction from this ramus towards the body. And then to the anterior part of this ramus, it's actually going to have a change in direction where it feels like the bone comes down and starts angling out towards the body in the front of it. And this is known as the oblique line of the mandible. So I can palpate the front of the oblique line, and that's going to start pointing us forward. Now, I like to use the oblique line to help us find one of our last landmarks on the outer side here, and this is known as the mental foramen. I'm going to tip her back to a straightforward position. So there is a foramen on the mandible on the external aspect of it, and it is not kind of central, but if you looked at the corner of the mouth and dropped below, there's often a little bit of a pit, or again, our foramen. So mental foramen. And just like the two previous ones in supra and infraorbital, if you gently rest your finger, you will feel a slight pulse from this location. Okay, the last couple landmarks that we're going to discuss are actually somewhat deep or internal, but not inside the mouth. So what I'm going to do is I'm just going to bring her, turn her neck, and I'm going to show you kind of the bottom of this body right in here. And I'm going to go up towards this angle, and by tipping her head in towards my chin, it's going to soften up the neck a little bit for me to sink underneath, and I'm just getting my fingertips up underneath. Take caution because we do have glandular tissue in this area, but this is known as the submandibular fossa, right in this location. So hooking into that submandibular fossa, I'm going to go a little bit forward, and I'm going to push a little bit harder, and I'm getting a nice wall of resistance. So there is a large group of muscle in your hyoids, your suprahyoids, and one of the large floor of your mouth is known as mylohyoid. So I'm running my fingers as best I can on the internal surface of the mandible along the mylohyoid line. So that's going to be fairly difficult to feel the line itself, but instead I'm feeling the musculature. If I can have you gently swallow for me, good. I get pushed out and then we sink back in. Let's do that one more time, pushed out and then back in. Lastly, we're going to take a look straight on. If I went to the mental protuberance and the tubercle, I'm just going to hook my finger under to the internal aspect of right in here, and there's two hyoid muscles right underneath, a left and a right, and this is known as your digastric. So let's have you look up towards the roof for us a little bit. Good, so right in here is the digastric fossa on both left and right. We cannot access the deeper structure from that, but if you were to push through, then you'd be getting towards what is known as the mental spines or genial tubercles, since they have the same name. But that would be needing to put a gloved hand and go sublingual underneath the tongue, and we will not be doing that. So those are going to cover the majority of the mandibular landmarks that we are going to discuss. We're going to be going through the zygomatic bone next. So the zygomatic bone is going to be sitting here. It's what you normally refer to as your cheekbone. And really, it's going to be pretty easy. It's a central bone with 3 projections going in 3 different directions. And they're all named for the bone that they're going towards. Plus, they have sutures near them. So I'm going to start by just palpating the front of the cheek here. So the kind of the body or center of this zygomatic bone. As we are heading up, beside the eye, the zygomatic bone is making up the lateral orbital margin right along here. So this is known as the frontal process, as it's meeting up with the frontal bone. So again, you can kind of feel that outer edge. Careful not to poke them in the eye as you're going along it. And as you're going back, so behind that's going to be kind of our sphenoid. As I'm heading, I'm just going to turn your head gently to the side here. So again, kind of the center of that zygomatic bone. I'm heading towards the temporal bone now. So just as you round towards the back of this, there's another suture line here. So this kind of portion of the bone is known as the temporal process, and that's a portion of our zygomatic arch. So again, we discussed that in the temporal bone. Half of the zygomatic arch is made up of the zygomatic bone. And I'm going to be rotating you back. And as I kind of round towards the front of this here, it's going to be meeting up with the maxilla. So again, there's going to be a maxillary process of this part of the bone here. So really, if you sink in, just gently feel, you'll be able to feel where these bones all meet. And these sutures are just named for the two bones that they are in contact with. So that shouldn't be too much. We will talk about some muscles in a different video coming off the zygomatic bone. It's easy to remember those are known as zygomaticus major and minor, and they're going to have origins on either side of this. But other than that, really, there's just 3 projections, and that's all there is to the zygomatic bone.